After roughly 4 years, federal recommendations for COVID-19 booster shots are changing. The CDC is removing certain groups from the recommended immunization list after protests from some medical officials. News Channel 3's Colin Roos spoke to a local health official tonight who says this change in protocol is unprecedented. Colin?
That's right. Pregnant women and healthy children are now off of that list. It's because the Department of Health and Human Services says there's no data to support repeated booster shots for kids. Now, that doesn't sit well with one medical director for Kalamazoo and Calhoun counties who's still seeing COVID patients in his clinic and the hospital. DHHS Secretary Robert F. Kennedy Jr. announced the change in an X post this week. He criticized the Biden administration, who he said needlessly pushed for children last year to receive additional shots years after the pandemic brought the country to a halt. While the move has support from other government agencies like the National Institutes of Health, it's already gaining criticism from the American College of Obstetricians and Gynecologists and closer to home at the Kalamazoo County Health Department.
This is a going around of the process. The usual process has been usurped.
Dr. William Nettleton expressed concern the announcement violates the chain of command for vaccine approval. He says normally the Food and Drug Administration approves vaccines before a group within the CDC makes recommendations for how they should be used. Once that process is complete, insurance is then required to cover the cost of those vaccines, something Dr. Nettleton isn't sure will happen with the new guidelines.
And that raises concern about the desire for parents and for the freedom of parents to elect to choose to vaccinate their child.
In addition, he has clinical objections for both of the groups covered in Kennedy's announcement. Dr. Nettleton says even though children aren't likely to contract severe COVID, many of the ones that do have no underlying conditions. He also worries that fewer babies will receive the benefits of a booster shot.
We know when pregnant women are vaccinated, they pass on some of that protection to the infants.
The FDA announced plans to limit the shot to those over 65 and those younger who have risk factors. The demographics Dr. Nettleton says still face the highest risk. He says we may still be learning more about COVID 5 years in, but we have a solid picture of who still needs protection from it.
So bottom line, talk to your doctor.
Now, we also spoke to local school districts to ask if COVID is a continuing issue for their kids. Officials with both Comstock and Vicksburg both telling us they've lifted many of their restrictions since the pandemic. Live in the studio, Colin Roos, News Channel 3.
Colin, thank you.